take some time to appreciate the organizing team for organizing this, because I believe this is a very good forum for us to learn, us to find ideas that we can help push forward the agenda of climate change and health. So I think David and the other presenters have really done everything I needed to do, and I'll just maybe add on to something, probably just insist on the importance of climate change and why it is important that we take part as healthcare professionals to advance the policies and to just ensure that we are in the forefront of fighting climate change. So I'll start with a quote by David Orr, which says, "The greatest threat to our planet is a belief that someone else will save it." So no one else is saving this planet, it's us who are going to save this planet. Yes, next slide please. So this is just, I'm a fan of AI, so I can tell you that this was purely made by AI. So it's just a picture to show the industrial emission of greenhouse gases. Yes, next slide please. So this is another hefty slide that basically repeats what Dr. Ojijo has talked about. So yeah, as he said, according to the World Health statistics that came out sometime this year, climate change is definitely the biggest global threat that we have right now. So due to the significant portions of temperatures up to 0.6 has been attributed to human activities. So it's also good to learn that we need to know where exactly we can make impact. So understanding how climate change policies work is also very important, as much as you want to make a contribution towards climate change. So it's also good to know that there's an international panel intergovernmental panel for climate change, which is IPCC, and UNFCC, which is the ultimate organization under UN that basically takes care of everything change. Yes, next slide please. So I think we've seen this before. This is just a representation of how the global temperatures are currently rising from the pre-industrial period to now. So you can see that in 2020, which is the last year that you can see, the temperatures are even going higher. So this is a concern because we might not be, Africa being a developing country, I would say Africa is the least contributors to global emissions. But in case of climate crisis like the one we are having now, we don't have proper mitigation and adaptation measures that have been set to survive climate change in case there is more disasters to come. And as you can see, even currently, these floods, is El Nino that is happening. Hospitals are getting submerged. People are running from their homes. All this comes from climate change. So I'm just giving these examples to just put you into that space that you might be doing or studying orthopedics. You're going to fix bones. But then, where are you going to fix these bones? Where are you going to get all the medicine from? All the infrastructures that you might need to get supplies are going to be washed away due to climate change. This is a repetition, so that's why I'm just going through them very quickly. This is another slide that shows how the global emissions are continuously rising. That's from 1990 up to 2015, and you can see that there's clearly a steady rise in global emissions. Next slide, please. So what are the key pathways that link climate change and health? Next slide. So just to give you a brief history of how climate change and health has become a topic of discussion. In the 1990s, the first IPCC, as I told you, Intergovernmental Panel for Climate Change, did the first report. This was the first time that health appeared as one of the agendas in climate justice and climate advocacy. And then in 2015, around 1990 was also the time that we had the first global conference, which is called COP. So this year we have the COP28. So COP1 was in 1995. In 2015, which I think was COP21, the Paris Agreement, which, because it was in Paris, so the global community come together to combat climate change and the devastating health impacts. Again, another aspect of climate justice that we need to discuss is, as we can see even from the title of the conference, it's towards actualization of SDG 3. If you have gone through SDG 3, there's no clear mention of climate change, and that's unfortunate because we are saying climate change is the greatest threat to public health now, but then it doesn't appear as part of SDGs. I'm likely to be corrected if I'm wrong. So in 2020, we had a pandemic, which was actually really bad, and it exposed how weak our system is in terms of mitigation measures and adaptation measures. And I think we should use that it should be something that we learn from, so that in case, or as we are already facing the effects of climate change, we should use that as an example to prepare early enough. Next slide, please. So we've discussed this before again. These are some of the pathways that link climate change and health. I think there was a bit of a switch in the slides, but extreme weather events like El Nino we are having now, drought, all those have an impact of health. I mean, people, I'll just give an example of the research that I have been involved in with regards to people living with HIV and how climate change has affected HIV care. I'll give you an example of Kajiado County, where drought there's been a drought for the past 5 years around Kajiado, and it's been so bad that the ART adherence has moved from 71% to 42%. This is because people are moving from areas or their homes to other areas to find water, to find food, to find better living conditions. And this means that they are moving out of the regions where they're going to receive care. So this has really made adherence to HIV medication to be a big problem. So this is yet another pictograph just to show how climate change interacts with health. I'm particularly interested in the changes in vector ecology, which my previous presenters have talked about. I know, like for malaria, you've been told there's increasing evidence of malaria within Nairobi. This is attributed to a new adaptable, I would say, mosquitoes. It's called Anopheles stephensi. So Anopheles stephensi was identified in Nairobi, and we all know that Nairobi is not a malaria endemic. So this is something that we should start getting worried about, because in the near future, everyone will be having malaria. Diarrheal diseases will increase. Like now we have floods, sewages are mixing with drinking water and all that. So this is such a big challenge. We've also talked about dengue fever, Rift Valley fever, Lyme disease, chikungunya, West Nile. I'll also touch on water quality impacts that have been affected. So there are increasing evidence of cholera outbreaks, cryptosporidiosis, especially for immunosuppressed individuals, malnutrition, as we've spoken about, forced migration, because people are looking for better places to go or better environments to go and live in, health-related, heat-related illnesses, and death, also part of the effects of climate change, especially extreme heat. Next slide, please. So these are just real-life examples of how bad climate change is currently. The fact that I believe we all live in Nairobi, but we might not be from Nairobi. But back at home, people are really suffering the effects of climate change, but no one is talking about it. No one is talking about it being a side or an effect of climate change. So there are examples of Narok, Kisumu, Mandera, Marsabit, and all those. So you can see in some pictures there's dead animals because of drought, and in other pictures we have flooded areas because of heavy rainfall. Next slide, please. So this has been said. So the health response for us as young healthcare professionals is to climate change should address both mitigation and adaptation strategies, as our previous presenter had said. So mitigation strategies aim to reduce greenhouse gases emission, while adaptation strategies focus on helping communities and the health system to prepare for the impact of change. So there are some things that we can't change now. There are already global temperatures that we cannot do anything about because it's already done. But what we can do is, going forward, we can reduce use of fossil fuels, which might likely reduce global emission of greenhouse gases. Next slide. So this is basically the question that you were asked before. So some of these are mitigation strategies, some of them are adaptation strategies, and some of them are where the two meet. So things like cleaner, smoke-free air, leads to less respiratory, cardiorespiratory diseases. Early warning system for adaptation, because it's already there. We warn, like now, there was a warning that was issued about El Nino, though it came way later than we had expected. But that's expected, the Kenyan government. Next slide, please. So I'll just showcase some of the things that we have been part of as IPPNW, which means International Physicians for the Prevention of Nuclear War. So we had a bike tour in April 2023, and the bike tour, I'm not sure you can see it down there, but it was themed climate crisis and mental health. We did a 500-kilometer bike tour from Nairobi to Mombasa, just to sensitize people on the impacts of climate change and how it might be related to mental health. So it's good because all the discussions that we have had today are basically on those lines. Next slide, please. So this is a very heavy slide, but it's basically what we've been talking about. So what are the roles of young healthcare professionals? So ensuring we are part of developing climate resilient healthcare infrastructures and practices by having a say, coming for a conference like this, or just having to project your voice and make people hear your opinions on climate change is a really important thing. And you might not realize that now, but later on, as you become older, these things, personally, I would say, I was doing the bike tour for fun, but then later on, someone called me and, what were you doing? And I was like, we were doing an advocacy. So some things might look like tiny things, but then the impact it has or the difference you make after doing them is really, really great. So we also know that, as our previous speakers had said, there is very limited research with regards to health and climate change. So we need more people to go to research. Not everyone has to be a physician, not everyone has to be an orthopedic surgeon. There's so much you can do out there that is not the clinical aspect of care. Advocacy and policy management. We should be able to speak about what we need to do, what we want to do, and going forward, what we can do about climate change and health. So professional development and training. I believe there are a lot of material that you can go online and check. You just need to get an interest on whatever you want. In this case, I'll advocate for climate change and health. These materials are everywhere. If you go to the UNFCCC website or the UN website, you'll find all these materials. Best courses that you'll ever see, most interactive platforms, and you still haven't had a chance to. I think you should go and check. Next slide, please. So in conclusion, this brief exploration of the intersection of climate change and health, it highlights the need of collective action. Together, we can sculpt a healthier and more climate resilient tomorrow. Is it done? Next slide. Oh, it's done. So basically, I think the reason why I got invited to attend or to speak to you today is climate change is something that has been ignored, and healthcare workers don't believe that it's their responsibility to bring this discussion. Currently, even as we are gearing towards COP28, which is happening later this month in December, the topic of discussion is health. Health, even in climate, the whole topic in climate change discussion is health, because, I mean, what can we do without health? We want to do agriculture, we want to be able to build roads, we want to be able to do anything. So this is my plea to you to maybe just get some information about climate change, even if you are to be an orthopedic surgeon. And for those also want to be an orthopedic surgeon. It's not, I'm not saying you don't do it. You just need to know how climate change might affect your work in the future. Thank you.